Hi, Jessie.
Hi, how are
Nice.
you?
I'm good. I'm good. How are you?
Good, good,
Thank you for
good.
doing this.
My pleasure.
Awesome. Well, I want to welcome you, and I want to welcome our audience. More people will trickle in as we go on. So I want to introduce you to this crowd here. So Dr. Mahoney is a pediatrician, and she's a certified life coach as well as a yoga and mindfulness instructor. She practiced pediatrics at Kaiser Permanente for almost 20 years. And during her time there, she was a leader in the physician wellness movement. And she's also a frequent public speaker on wellness, mindfulness, and coaching. She's the founding leader of the Mindful Healthcare Collective and an assistant volunteer clinical professor of pediatrics at UCSF, chair of the San Francisco Marine Medical Society Task Force on Physician Wellness. So I am so pleased to have somebody like Jessie come on to talk to our physicians here on the Lifestyle Medicine Physician Group. And hi, Deepa. We see your comment. Yay. So you guys will see a small little thing on top of the where we're going live. And if you click on that thing that says StreamYard, you can actually go in and change your name so we can see whose comments they are as they pop up. So what I was going to do is, it's Sunday afternoon and I'm kind of in a chill mood here in the Pacific Northwest. And I'm very much in the mood for maybe a short mindfulness practice. And Jessie's been so nice to accept that and lead us through one. So I'm going to ask her to start with that.
Excellent. So just to start, so we can all ground and get comfortable for this conversation, if you can find, as we say, a comfortable seat. And now every time I say that, I think back to, we had Mick Krasner on a Mindful Healthcare Collective session recently, and he said, isn't it interesting that we don't find a comfortable seat until someone invites us to do that? So I offer that you can find a comfortable seat before we invite you to do that. But for now, just find a comfortable seat. Notice your feet ground sitting on the floor and your hips grounding into whatever you happen to be sitting on. Or if you're standing, just your feet on the earth. Allow your spine to stretch up out of your pelvis, the crown of your head reaching towards the sky. With intention, drop your shoulders. Place your hands on your thighs. Flip your palms open so they're in a more receptive position. And get in touch with your breathing. Just notice what's happening with the breath. Notice the air coming in through your nostrils, coming out through your nostrils. Allowing yourself to just pause and be present for a few moments on this Sunday afternoon. Connect simply with the breath. Nothing else to do, but notice the air flowing into your body and out of your body. Notice your chest rise and fall as you lengthen the inhale and lengthen your exhale. Breathing in a little deeper, breathing out a little more fully. Allowing your lungs to expand much further than usual. In our usual days, our breath is often about 30% of our lung volume. So with intention, breathe in more deeply. Breathe out more fully. This time, allow the air to come in through your nose and out through your mouth. Breathe in through your nose and out through your mouth. Bring your awareness to the sensations that are traveling through your body. What else do you notice? Any tingling, any awakening, any space in your chest, sensations in your fingers, in your toes. Bring your attention back to your sit bones, connecting with the earth. Bring your left hand to your heart and your right hand to your belly. Notice your chest rise and fall. Can you feel your heart beat underneath your hand? Notice this consistency of it beating. Send appreciation to your heart for beating every moment of every day, keeping you going. Send the next breath in that space behind the heart, creating with intention some space for the heart to fill more fully and diastole. Sending more blood, positivity, and energy to the rest of your body. And connect for a moment with one thing about yourself that you would never want to change. One thing that you connect with that you would never ever want to change. Hold on to that with you. Bring your hands to heart center. Palms pressed together, finger pads pressed together, elbows out wide. Press your thumbs into your sternum. Take a moment to connect with your intention for being here right now. Your intention for how you want to show up for the rest of your day, all the people in your life, your community, the world around you. Pause for a moment and choose how you'd like that to be. Bring your hands back to your thighs. Allow your eyes to open slowly and gently. Let the light come back in with just a soft gaze to start. Notice if your shoulders have hunched up and let them relax down. Notice how you feel now compared to how you did a few moments ago. What feels different? And can you bring a little bit of that attention to the breath and attention to your body with you into the rest of your afternoon? So I'd love to know how people feel. I like to offer in yoga and mindfulness just this concept of the breath. I like to keep it really simple. And I teach in a lot of my yoga classes this idea of the breath is always available to you. And so even as busy physicians in our office or busy parents with kids screaming, you can just take a deep breath. And so I find when people feel anxious, and I notice this with a lot of physicians, we hold our breaths. We hold our breath in difficult procedures. We hold our breaths in difficult conversations. We hold our breath and don't make time to take a deep breath. And so if you can just notice where you're not taking a deep breath, and even in that few minutes, which was probably 5 minutes, just changing your breath really changes everything about you. And so can you just do that for just a moment in your day? I like to think of mindfulness as easy. And so that was 5 minutes, which to me is actually a long time. It doesn't mean you can't do it longer, but for a lot of people, carving out 5 minutes can take time. But you can do it in 1 minute or 30 seconds, like just noticing and being aware and taking a deep breath, noticing what that does for you. It's not quite as beautiful and luxurious as 5 minutes, but it's better than nothing.
Mm-hmm. That was really beautiful. Before I started the broadcast, I thought I was already feeling, fairly calm.
Mm-hmm.
There's always a little twig of nervousness before going into these things. You're concerned about how it's going to go, how it's going to land with people. You're concerned about whether the technology is going to work.
Right. And I'll just fess up, my technology did not work for a few moments there. So I'm sure I caused a little more anxiety.
But just like you said, just that 5 minutes was enough to really make that go away, and make that feel like it's okay. I mean, so what if the technology didn't work? And so what if it doesn't land with everybody? We can't stop that from making our offerings. And I think that's the power of mindfulness, is kind of bringing you back, like you said, to the present moment and being okay with it, no matter what that moment looks like.
We often say in coaching, of course. And so, of course, the technology didn't work, or of course, whatever happens, it's like, well, of course that happened. And it's that idea of mindfulness, right? It did. So that, of course, it happened, but it just takes the pressure off, right?
For sure. For sure. So, Jessie, I'd like to maybe start with asking you, it sounds like you had a pretty conventional start to your career with, going into pediatrics. Can you talk a little bit about how that was, and then how you sort of got involved with the whole physician wellness program at Kaiser and stuff?
So funny, I probably, as you say, conventional, I'm going to just say I didn't really have a conventional start to my life. And so the fact that I had a long conventional career, now that I look back on it, is very surprising. So I grew up in Berkeley in the 70s with hippie parents, and we traveled to crazy places in the world and did crazy things. And I missed lots of school. And that was just sort of my upbringing. And there's even more to that story, which I'll leave out. But I did not have a conventional upbringing. And so then I kind of went to conventional college. I went back east to Dartmouth, and then I went to UCSF for medical school, and went into residency. The part that wasn't conventional is that I actually had a baby in medical school and a baby in residency and a baby afterwards. And so definitely impacted my career. I have 3 boys. But so during all along, because I think probably because I had children, I was very focused on wellness and trying to figure out how to do medicine and still have a life. And I did even I first got into yoga as a medical student. I went to some workshop where she had us work on our toes. And it was really this enlightening thing that, like, focusing on your toes could really change how you experienced your whole day. And I haven't talked about that in a long time, but I still remember the woman exactly who did the exercise. And it was really sort of a profound experience for me. So as a resident, and even I did a year of chief residency, and I had a real focus on physician wellness already early in my career. And so fortunately or unfortunately, I've always been someone who spoke up and said that things needed to change. And so really early on, my first year in practice, I was asked to lead physician wellness, like my first year in my practice, because there was no one else doing it. But what I'll say at that time is there was no money. It was not a thing. We were in the back closet. You could do anything that was free. And so I think, it's absolutely evolved from there, because that was in 2003. And so by the end of my career, we had huge teams and regional meetings, and not lots of money, but we were able to put on regional conferences for doctors with 400 doctors and all their families, and invite national speakers. And so it was a long course of very different experience. And I think it really just was someone who always spoke up and said there has to be a different way. And I think I've thought kind of since the beginning that my belief is that if we don't take care of ourselves as physicians, we can't really take care of others. And
absolutely.
And it comes to mindfulness in coaching too, right? If we're whole and intact and empowered and healthy, then we show up that way, and we're able to really share those tools from a very much authentic place. So that's really where I was coming from. I think what's different from now is what I mentioned in the beginning, which is when I started and when you started, because we're close to the same age, that was not an accepted belief. And I, actually it was like pushing a boulder up a hill till the end. And then it was like, okay, now what do you want to do? But it was not that way in the beginning. And I noticed someone mentioning like mommy doctors being conventional, and I would say that they are now, but in 1996, which is when my son was born, there were very few women who were having babies in training. It was not, it didn't make people happy. How's that?
Yeah.
But actually, in my medical school class, there were 7 of us that have babies, and all those babies are now 24. And it was sort of like a thing that to us felt like a huge change. And anyway, it was kind of an interesting course. And I do think that now that's part of the reason, we realize so many physicians are women, and I've heard a number of conferences around this, that it's meaning that medicine really does have to change, right? Because it's not possible to do all of it in the way that we're set up to do it.
Yeah. Yeah. It's reflecting back on what you were saying about, it seems like having children, there's never seems to be the right time. Do you do it before you get into medical school? You're still too young. You're just starting. Do you do it during medical school? That's not looked upon very well. And then do you do it during your residency? I was my life was never planned, to be honest with you, but the way it happened was I finished medical school, and then I had an arranged marriage. So I was in transition. So I actually ended up staying at home for a few years. And that's when I had, did the baby making thing and then went back to residency. But I do recall when I was in residency, I think there were 3 residents. It was a big program, 10 or 12 each year. About 3 residents over the 3 years became pregnant, and I can tell you it was not looked upon very well either by the attendings or the other residents, because they're like, oh, now we have to pull their weight and all of this. So it's very challenging, as much as I'm sure, of course men have challenges too, but there's something very specifically challenging about being a woman physician, for sure. And how do you keep all those balls in the air and not just like collapse under the weight of it? Yeah. And kind of going back to what you said, I was never taught to take care of myself during my medical school or rest. In fact, the opposite, subliminal message was true, which is you put yourself last. I remember as a hospitalist, I'll leave home at 7 in the morning. At 6:30, get to the hospital at 7. I'd come home at 7 or 8 at night and realize that I had literally not peed all day.
Yeah.
Like if one of our patients did that, can you imagine? Like we would be so.
Yeah.
So I'm glad that we're talking about this now a lot more.
Yeah. And I think it's very hard if you're really thinking about lifestyle medicine, right? Which this group is all about. Like we need to model how to live healthily and be the models of lifestyle medicine. And this idea of self-sacrifice does not mesh. And so how do we bring it all together? And I one of the things I think over the years of physician wellness, I've really gotten away from this concept of balance and people trying to find balance, because I think in medicine, it's all one, right? And you can't, your family and your practice, they're all, you bring your medicine home, your kids are calling you at work, or your husband or your parent is sick. And maybe even COVID has made that much more clear for people that these lines are very blurred. And right. So I just really like, the physicians are people, the patients are people, and we all need to have this like space and compassion for one another. And that's really, I guess it's mindfulness about the situation rather than compartmentalizing and just being more whole and open and vulnerable with our humanity and an right. acceptance of being, as we say, perfectly imperfect.
Yeah. Yeah, for sure. So you mentioned coaching. How did your journey kind of evolve into becoming a coach and mindfulness? Like what was the trigger, if you will, that made you kind of go down this path?
So I was actually trying to think about this before we started talking. I usually say that it was a couple of years ago that I got into coaching and I had kind of a crisis moment, and I'll tell you about that. But I actually think it started maybe 10 years ago when I realized I had checked all the boxes. I had done medical school, I did residency, I was a chief resident. Now I had this thriving practice. I had all the leadership roles, and I was still, and the kids and all the things, and I still wasn't totally content. Mm-hmm. And so I did what most people do, which is I was like, okay, well, maybe I'll shift my practice around. Maybe I'll change the circumstances. And so I switched locations and I built a whole new practice, and I switched from what was more of a we call it a satellite, but it didn't have a big residency program and we weren't attached to the hospital. So I actually was a hybrid that did some hospital work too and still taught residents, but I was the only one. So I thought, well, if I switch to the place where everyone's doing that, everything will feel better, right? So I did that. And then I got more leadership jobs, and I went from being the chief of wellness one place to not having any leadership roles, and then being the chief of wellness at the next place because I can't help myself from speaking up, right? That's my thing. And what I discovered was that, I kept getting more jobs, and still I was still searching, right, for the thing that was going to make it all just right, like what I was planning. And this is where I get to the sort of moment of crisis. A couple years ago, I had just opened up a whole new Kaiser building, and I was running pediatrics in that new building, and it was a huge project. And so I had done that, and I was now this, big chief of wellness, and I had a thriving practice, and I had 3 kids, 3 teenagers, I want to add.
Oh, wow.
So they add a little extra piece to it. And then my husband developed pretty severe depression. He was a lawyer and was like that really was like the thing that just pushed me over the edge. Okay. So I had it all under control, but
oh man,
for the answers, but had it under control. So, and then I don't know whether I did or didn't, but so what happened at that moment was that I tried to fix it for quite a while, because that's what doctors do, right? So I was going to fix him. I was going to take care of everybody there. I was going to take care of everybody at work and all the doctors, because wellness was my job. And I realized at some point that even as the wellness person, I was not taking care of myself, and that I just couldn't see like the next place to go. And so I actually hired a coach. And I'm not really sure. I listened to a lot of podcasts, like a lot of people. So I knew there were people out there. I didn't know at that time that there were physician coaches, and there may have been a few, but there weren't very many. And so I hired a non-physician coach, but someone whose podcast I had listened to and I very much liked. And I worked with her for 6 months, and it just helped me see the possibilities and realize where I was getting in my own way. And
can I ask you something real quick, Jessie?
Yeah.
So when it seems like when a lot of physicians are kind of in that, or not just physicians, but people in general, when you're kind of facing what you were facing, it seems like a lot of people might actually go seek counseling instead, or therapy. Was there a reason you chose a coach versus a therapist? Because I'll fess up, I did have therapy for 3 years.
So that's a really good question. And I'm smiling because there's some vulnerability here, and first of all, I didn't want to have to see a therapist, okay? Because I just have to laugh. So I thought that I wasn't the one who was sick, my husband was. And so he was seeing a therapist. And I was also very frustrated because they weren't helping him. And so I thought, like, if they can't help him, how are they going to help me? And in my mind, and I'm not saying they wouldn't have helped me, but what I see and what I've come to understand very clearly is the difference between therapy and coaching is therapy, you look a lot at the back end of how you got here and what led you here. And coaching is like, where do you want to go?
Right.
And so if I look at my personality, I'm moving on. Like, I just want to know how to get out of this. It really got into my fix-it tendencies, although it turns out that fix is you, right? And that's okay. But I think so there were a couple reasons. Like, I was frustrated, and so those were the reasons that I didn't. And I'm not saying they wouldn't have been helpful. I also want to say that I did some work on the California Medical Association subcommittee on physician wellness, and there's always this issue, of course, physicians who get mental health care and how is that looked upon and what. And
yes.
So I had been involved in some discussions around that. So to me, like, it was another reason that I was like, well, if someone asks me and like, how do, so I know that a lot of people feel that feeling. And so I want to call that out. It's changing 100%. And there are lots of discussions at the legislative level in different states.
Right.
Eventually. But I also feel, to me, like that's why physician coaching is amazing, because you can get support.
Yes.
You shouldn't, if you are the one who's depressed or is having a significant mental health crisis, you please get therapy, please go see a psychiatrist, please do all the things. Like, coaching doesn't fix that.
No.
But when something that's either circumstantial and or you're just lost and you're not really sure like what the solution is,
Right.
having someone guide you is really, really helpful.
No,
And so I didn't work with a physician coach. I think the real difference around physician coaching is that they understand where you've been, what the job is actually like.
Right.
And a big piece of it is the way that we were trained to think. And many of the things that we look at in coaching is these like limiting beliefs and ideas about how you're supposed to do things and what you should do and what makes a good doctor and a lot of the self-sacrifice things. And so physician coaches are pretty like tap into that. And it's like, well, of course you think that because in residency you were taught this, and people are like, oh, right. And so much of the beliefs that got us to where we are now don't really help us in living this happy life, satisfied life, and even being satisfied in your career, I guess I would say, right? Sure. And so it doesn't actually mean that you need to change careers. Often you just need to figure out what it's going on about you and what you need to change, or in your own thought process, what you need to change. Totally. And of course, I discovered by changing it, I didn't solve the problem because the problem was other things. And being really in alignment and figuring out like with intention where you want to be, what you want to do in life and in the world, and what's a good fit. Because I think in medicine, we just do and we do and we do, and then we end up somewhere. And it's like, oh, wait a minute, why did I end up here? And is this where I want to be? And sometimes you can change it by changing your thoughts about it. And sometimes you actually need to make a change and say, actually, the difference I want to make in the world is this.
Well, to kind of piggyback, and I haven't talked about this, openly about therapy, and it's that whole. So I work for group health, which is similar Kaiser model, and so they were so worried about, not worried, but they were aware, my primary care, of this kind of getting on my records, right? And I was miserable. I mean, everybody could tell I was miserable, and so they actually allow you to go outside the system. A lot of times in Kaiser, they want you to use their system, but because I was a physician and they didn't want this to get on the record, on my medical record, they actually allowed me to go and see a therapist on the outside. And when I look back now, I realize, I really wasn't depressed or didn't have a mental health issue, and probably a coach would have been a better solution for me, because I loved my therapist. She was great. She held space for me, and there was a lot of crying in her room. But the reality of it was there was not that forward momentum. So I kind of stagnated in the same thing. I would feel better for a while, and then, something would blow up at work, and then I was back in the chair with her. And so, when I left, I asked to review my notes, and I realized I had made like almost no progress. And so, and like you said, the concept wasn't even in my brain that there are coaches out there, so, but everybody's journey is different, but I just wanted to kind of.
And a lot of people come to coaching after therapy. That's the other thing I found. A lot of people do. Not because, again, I think if you have a true mental health issue, it's not the same thing. And I don't want to step on anyone in mental health, realm. But I think coaching and mindfulness and even yoga, like all of that philosophical stuff, brings a lot and helps a lot of people heal and move forward. And we're all different. And so you sort of need to look at what helps you. But I've also found in my own practice, I'm a pediatrician, but with teens and stuff, teaching them mindfulness in my practice, or helping them get started on yoga and helping them, just with kind of these mindset shifts and having them just notice what they're thinking and how it can actually make a big difference. And I used to do it while they were waiting to get into mental health, because there's always a wait, right? And so it's like, well, in the 6 to 8 weeks while you're waiting, why don't you try Headspace? And I think that was very useful. And I see Deepa's mentioning if there are therapist coaches. I believe that there are a few. I think the challenge that I have seen is that how do you keep your I'm going to call it malpractice, but therapists probably have some different version of that. And like, how is it medicine versus coaching? My understanding from some of the psychiatrists and is that they do learn coaching in psychiatry training, that there is a component of coaching, and they feel that they do some coaching. I think it depends what medical model you practice in. So like a private practice psychiatrist probably could do coaching. I know that but I do know that there are a few. I don't know of any like physician ones, but I think there are people who are marriage family therapists, and a lot of them will sell their services as coaching. And I have no idea how that works. But I think for physicians, it's actually really important to be clear about what you're wanting to do and what you're wanting to get out of it. And also what kind of coaching you're wanting to do, because coaching is not the same, right? So I do very much mindful coaching, and I try to bring mindfulness and intention into it, and really that noticing and awareness and connecting, because to me, that's just what's authentically me. Some people are doing business coaching or leadership coaching or speaking coaching, or, and so there's very much different styles, and people are looking for different things. And so, again, not all coaching is the same. And even coaches, so I trained at the life coach school, and there are quite a few physicians that have trained at the life coach school. And yet I think we all brought our own unique, authentic selves to life coach school, and we bring that to coaching. And so we're very different styles. And what's really important is finding someone whose style resonates with you. And it sounds like somebody someone who's a nephrologist has hired a life coach who was not a physician and has found it super helpful. And I do think that, to me, it was the thing in all my years of like physician wellness. I was always looking for something. And so like that could really fix it. And I know that there was always a lot of criticism, like, well, and I am a yoga instructor and I believe in yoga, but like, well, you can't just give us yoga. That won't solve the problem, right? And resilience training won't solve the problem. And what I love about coaching is it won't solve the problem either, but it allows us to become empowered and whole so that we as physicians can help be part of the solution. So if we show up as victims, nobody's part of the solution. And so this concept that we're empowering the doctors to really ask for what they need and see what they need. And we all have the solutions within us, but if we are all just exhausted and burnt to a crisp, right? No one's able to make the changes, and everyone's just blaming everyone else. And I don't mean that in such a negative way, because I think everyone's still trying as hard as they can. It's just that the system has so many issues. And so I absolutely think the system needs to change, but coaching was the one thing where I really felt like helping people figure out themselves and figure out who they want to be and how they can live in alignment with their medical practice, and how do they want to live intentionally. That helps them show up for these problems in a way that we can all be part of the solution.
Right. Are you seeing, now more and more, like a lot of organizations, like wellness programs are, pretty much a common thing anymore. But it seems to be like, again, the devil's in the details. And sometimes you get this sort of sense that they're kind of just doing it because it's an expectation, but maybe it's not necessarily being so helpful. What is your sense of what's going on, especially in medicine?
Probably what you said. Yeah. I think that everyone has very good intentions, but where the issue is, it's still the business of medicine. And so what they want to do is have a wellness program. And if the wellness program, I feel not very tactful saying this, but right, if the wellness program helps the doctors do what they need them to do, then they're very happy, right? But, and so that's sort of the difference from an institutional. I think that there's tremendous possibility, and with the right leaders and people who really understand wellness. And I think one of the things that I'm involved in now, I'm doing some coaching for the fellows at Stanford. And I think this idea of doing coaching early on in training, and what I'm so impressed with there is that the leadership of the fellowship program is just like, no, this is what we need to send our fellows out into their practices with these tools and strategies to have a sustainable career and to be part of the solutions and part of the teams, that's really incredible. And so my hope is that that will be the next generation of physicians, right? And then the culture change. I mean, what we really need is culture change. And
for sure,
I'm actually hopeful that all of the chaos of the last few months, like some kind of culture change has to shift. And so I do really hope that things will shift.
Can you tell us a little? Yeah. I'm sorry, go ahead.
No, go ahead. You go ahead.
I just was really curious about this coaching program at Stanford. Can you give us like a little bit more details about like, I mean, how does that work? That's so cool. I wish I'd gotten coached when I was in medical school.
It's totally random. Yeah. I'm just going to say, it's turned out to be, and that's actually what I'll say about my path. It's funny. I'm in a number of different physician groups and everyone's really worried about what to do next and how to get to the next step. And I just believe if you just show up open, and this is probably my Berkeley hippie background, so I just preface it by that. But when you show up open, like crazy, interesting things start to happen. And so I coached an attending there and with some COVID stress. And it was actually just something that was not like long-term, but this person was really having stress about intubating patients with COVID, and as many, many, many doctors were, right? So at the beginning of that time, I actually offered, which I don't usually do, to just do a session or two for like people that are just, really trying to figure out how to approach this and how to go in with a attitude that really made the situation much more smooth. And so I coached this person, and then this person said, hey, would you be willing to coach the residents at a discounted rate? And I was like, sure, that sounds fantastic. And I said, but I don't know that that residents will be able to even afford it at a discounted rate. Because thinking back to when I was a resident, right, you're trying to eat and pay your rent, right? And so I just said, like, what if the program offered group coaching instead? Then you guys could pay for it and they could show up. And then they said yes. And so I was like, okay.
That's
so then
awesome.
I had to, it was really, and we've been learning along. So we did twice a week for a month, and now we're doing once a week for a month. And now we're looking at doing coaching actually as part of their yearly program. Mm-hmm. And we're figuring out how it's going to look as we're seeing how people are able to show up and how the scheduling. We have learned, I think, that in my experience, physicians in general and residents in general, they need some one-on-one, because people are really, as vulnerable as we might want to be, we feel very, very vulnerable. And so I found that there are a lot of things that we all struggle with that people, no matter whether you tell them it's safe or not, they don't want to bring it up. And so I think we're looking at a hybrid model for next year so that they will have some individual sessions and some ongoing groups. And I think that I personally think that's what everybody needs. Mm-hmm. I do almost exclusively one-on-one. And then I think when people have done one-on-one and they're really comfortable with the process, then they're happy to be part of an ongoing group. And so I think that for me will be the larger models, like people work on their own things and they feel comfortable with it. We all need to tune up and we all need to kind of stay, even coaches work with coaches regularly, right? Right. Because our minds tend to go rogue on us. And so I think, I don't know. It'll be interesting to see. But I love doing the one-on-ones, and I can see that there's power in that as well. And, there's so many different issues. Some of it is self-care. Some of it is, colleague interaction. Some of it is marital stress. I do a lot of marital stress, parenting stress. And again, I find that it's all part of it, right? If work is stressful, then your marriage is stressful. Yes. If you have a sick child, then your work is more stressful. It all tends to weave into one another. So I think that's I think it's just a really powerful tool.
So
this is a yoga instructor, pediatrician interested in coaching. Yeah. And so it's interesting. This is my personal opinion, that pediatrics makes it easier because you're coaching adults and not children. So they would obviously not be your patients. I think that especially, and I mention this because it's a lifestyle medicine group, I think there are a lot of med-mal challenges. If you were to coach patients, then you would need to do it really within your physician relationship. I think that you need to be really, really clear about what you're doing and why. And whether you're a coach or whether you're being a physician, and you have to keep that, in my mind, very, very separate. I don't think, it's early on. Right now, to me, it seems relatively clear, like what I do as a coach is very different than what I did as a pediatrician. Whether, parent coaching tends to overlap a little bit, but I have people sign something that says that I'm not acting as a physician, I'm acting as a coach, and that nothing that I say is considered medical advice. And but your med-mal will not protect you for coaching, and your coaching insurance will not protect you for your med-mal. So I do think as people get into this, and it was interesting actually, because I posted in the group this idea of coaching as being like the answer to a lot of the lifestyle medicine. And
yes.
So many of us want to bring it to our patients, and we want to make it part of medicine. And I do believe like coaching and mindfulness and mindset work would change like health completely.
Oh,
and
yes.
If all the doctors practiced it themselves, and then we were able to share it with patients, like we could solve, I won't say glibly, but the world's problems maybe, but maybe
totally.
I believe we could solve the world's problems. But the question is, in our current model, like, how do you do that? And
right.
So I found that I was trying to do that and teaching patients about mindfulness. And one of the things I used to say all the time to parents is like meditation. As a parent, they would say, what can I do to help my kids' development or help them do well? And I'd be like, meditate yourself. Like, that's the best tool for parenting that I know, is to be mindful as a parent. And so the question is how to put those two together. And so I do, yes, I think coaching, like all physicians should be trained in coaching, but I also think it depends what kind of coaching you're doing. I think it's useful to understand it as a physician, but we can't expect all physicians to also then be coaches and be coaching our patients in practice. Like, right. Unless we change the model of medicine, and maybe in, direct primary care, you could do that, or like if you have a lot of time, but, and I hear a lot of people saying, well, can insurance pay for it? Or, and so it's really a societal cultural shift. And I'm not sure, I don't know how that's going to shake out. I'll just leave that there. But I think you need to be very, very clear what you're doing and why, and whether you are being a physician and a patient, or we call it a client and a coach, right? And they're actually a very different type of relationship. And I think you have to be clear when you show up, right? As a coach, you're not like an empathetic listener. That's not your job. Like, you're showing up very, very differently. And I did, in California, we have this program now, it's called Care for Caregivers, and they're doing like teaching people how to peer coach. And as I was part of that sort of training, it's very clear to me that there was some discussion about coach training. Coach training was very valuable to me. I learned a lot, and being a coach is very different than being a physician. And so I think they are very different tools and very different skills, and you might like one much better than the other, right? You don't tell anybody what to do as a coach, and so you have to choose who you are. And so much of what I think about this, mindset work is you have to figure out who you are. There isn't no better way to do it. It's not like there's one path to happiness in medicine or one path to happiness in parenting, right? We're all individuals. And so we have to touch into that and see, who you are.
Yeah, I think that's just not to belabor the point, but what you pointed out, like as physicians, we have a certain set of tools and certain mindset of how we approach patients. So it's kind of like this, I'm an expert, I'm bringing in my expert knowledge to help you figure out what to do with your health. So there really is a lot of sort of advising and telling them, what we think is right for them. But I think, like you said, with coaching, it's more of a, drawing out what's in them. Inside them, you're just holding up a mirror basically and saying, right? And I think it's hard. It's really hard to make that mind shift as physicians, because we've been trained a certain way. So if you really want to do coaching, and you have to sort of be very, again, mindful and conscious that you're shifting, then it makes sense to do some sort of a coaching training, because it changes how you're approaching the patient or the client or whatever. So it definitely is not the same. For sure.
And I would say the other thing is to get coached yourself. So you know what it is and how it works, and how it feels. To me, I see a lot of people like, I just want to learn how to coach other people. And to me, that's a very physician mindset, right? We want to come in, and I'm a physician and guilty of it, right? I always want to just fix things and move on. But you really do need to do that inner work on yourself. And that is what I believe it makes you a better coach, but it also allows you to truly understand the work. And that does kind of bring me back, I think, to the mindfulness, right? Like we have to be willing to look inside and be willing to change ourselves and be willing to change how we approach everything. I don't mean to say it glibly, but really everything, right? And how we show up in the world, and be willing to kind of take ownership of that. And so I think it's an integral piece. It's like for me, it was a complete life shift. I mean, people would say to me afterwards, what happened to you? You know, I think I was pretty nice before, but I really had a lot of people say, what happened to you? Now I will say, I did lose in the process. I didn't get into coaching at all to lose weight, but like once I started doing yoga and like valuing myself and paying attention and being mindful, it's like you just shift how you do everything. And so I lost a bunch of weight, and I, became a yoga instructor and a coach, and was like doing, people were like, what is going on? Which wasn't to say I was always the wellness person, but then it was this, like, I just showed up for the world very differently. And that didn't just come from a coach telling me what to do. It came from me deciding that I was going to
and doing the work on yourself. Yeah. And, and I think that's, again, I still don't get the sense that there's that much emphasis on personal wellness. And that's why I wanted to bring you on into this group, because, as physicians who believe in the principles of lifestyle medicine, and many of us are having to actually do it ourselves, because that's how you also can explain to patients why you think, whether a certain diet is good for you, or whether you need to exercise more, or you should meditate, or whatever. Because if it's kind of like, if you don't do it, there's not that power behind your words almost, So and just seeing how much, and I think I'm getting also the sense that a lot of physicians are looking for alternate ways of practicing. They're tired of being told to see 30 patients a day. You're putting the money into somebody else's pockets, and now COVID hit, and physicians are getting furloughed. Like nobody ever thought that would happen, or nurses. And so it's almost like this pause is a great time for us to really think about what our values are and what we want, what is the kind of life we want to fashion for ourselves. And like you said, how we want to show up in the world, rather than being told as a medical student or a resident or fellow, like, this is the mold, you got to like fit in this mold, So a lot of times when you say like you spoke up, right, that like we're known for, I mean, you would think like, why not? Like that should be valued, not felt, not like dinged, right? And I used to be a speaker outer too. I mean, not as much maybe as you, but you people look at you like, don't do that because you're going to get into trouble. It's like, we're not in kindergarten anymore.
It's interesting. I didn't really get into trouble. And I just want to say this though, as I look back now, I was able to do these really amazing, incredible things. And maybe it's part of, coaching and mindfulness, but I realized how much I grew and how much I learned. What I wanted to reflect on is the cost that it had on me to be the one who was constantly pushing the change and constantly saying like, wait a minute, this isn't right. And how can we do it? And I took that upon myself, and I ended up completely exhausted and feeling like, because when you're doing it, within all of these systematic limitations, you're constantly compromising and constantly. So as much as you're putting all of you into it, what comes out of it is not all of you. It's some other version that's been melded around to meet all the other requirements. And so that's where getting back to who you are in the end and what you're really passionate about, and just being open to being creative. And I was talking to a physician the other day, and all they do is like ADHD, and that's their thing, and they love it. And I was thinking like, we are all these amazing people, and I don't know a physician who's not a hard worker and doesn't have tons of interests. And what if we let people like be themselves and thrive and figure out who they are? And I do think that that's where the mindfulness and the introspection about who are you really, what are the things that you love, and what is special about you, and what you want more of in your life and what you want less of in your life, and being really intentional.
Yeah.
The exercises I love is like, look at yourself 5 years from now. And like, what would that person tell you to do now if you were living a different life, the life you want to? And how do you want to feel? A lot of us people look ahead and they're like, I don't know. Like, I wasn't thinking 5 years ahead, right? And it's like, how would you be feeling then? Or how do you want to feel in 5 years, right? And then you can start to say, well, what can I do now to get to that? So as physicians, we're always looking at the goal, like, okay, well, I'll just come up with this goal and I'll add in this second income and I'll add in all these things. And so I really like to get in touch with, like, how do you want to feel? And because that gets you in touch with like this authentic life. And I don't think it's like dreamy or hippie. Like, I think when you're really connected with what you want to do, you can make powerful change. And physicians are incredibly smart, incredibly talented, incredibly resourced individuals. And perhaps all of this is happening to make us all stand up and do the things that we're meant to do with help, right? Like, I think I spend a lot of time spinning, like wanting to do things, but not being sure, like, how do you connect to it or how do you get to the next step? And and it isn't that someone's going to tell you how to get to the next step, but to guide you and mirror back to you what you're thinking and what you said. Because sometimes I say, I said that, like, I really want to do that, huh? Yeah. When you write it down, you edit it a lot, where you think about it, and when you talk, you don't. So
you're right. I mean, I think a lot of times I find that, like, I'm so much in my own head, and I have like these two voices kind of talking to each other, but there isn't really that powerful reflection when you're talking to another person, like you said, and they reflect back what you're saying, and that makes it more clear, like kind of how when we have our patients repeat back. I used to do that, check for understanding, okay, we went over these 5 things you're supposed to do. Can you repeat back to me? And they would get like 2 right. So, yeah.
Well, I do think I was reflecting on some of the things that we talked about, and I think everyone has good intentions. I mean, I think I just have, I maybe in Madrid am too positive or, living in nirvana here, but I just believe, like, even, the healthcare organizations, they want to provide good healthcare. It's like we're in a really difficult situation. And that's where I think if each of us steps up and owns our talents, everyone, what we could do amazing things. And so someone sent a message about, let's see, people have niches with professionals. What about the ability to touch others with completely different backgrounds? Is there a model of someone who coaches those? I think that there are people that are interested in trying to do it with low socioeconomic status or social determinants of health. I think the challenge is, of course, who pays for it. It's always the challenge in life, right? And that is where, for those people, say you worked in a federally qualified health center and you wanted to have some kind of training, right, in coaching, you could bring some of these tools. And some people have created online content, so if that's where you want to go, you could certainly, I think there's lots of options. I think it's open to creativity. It may seem like coaches have all been out here doing it a long time, but I think it's a very new thing. And so the question is, I think that possibilities are all out there. We just need to look at the different choices and figure out who's going to do it, or maybe we can get someone with deep pockets to pay for it. I'm always looking for that, right? Like, so I just don't know in our world today who that will be. But I think, as physicians, if we figure out sort of a dream and how to make it happen, then you just start. In coaching, we say you start by starting. So if you have a great idea, start by starting. I often approach things also from, I call it like the least, it's a chemistry term, the activation energy, like lowest activation energy. So start by starting and do something, right? And so how I got on this journey was literally, I went to yoga class one day and I was like, oh my, I have to do something, And so I just started going and I just started breathing. And then I was like, okay, tomorrow I'll come back, and then tomorrow. And then I thought, okay, well, now maybe I'll reach out to that coach that I was listening to and just see. So it's like one step at a time. We're not used to that, right? Because in medicine, we're used to like following the directions. But
I guess
There
some of this
isn't a
is really
direction.
your own journey, like you said. Yeah, it's
Yeah.
like following those crumbs. I mean, basically, that's what I feel kind of, that's what makes it unique too, how we all show up in the world and what we have to offer. So, yeah.
I can't see, Jonah asked a good question, and I can't
Oh,
see the bottom of it. Do you know how to
can you
make
see
it?
this? Yeah,
I can't,
actually, like,
it's cut off, so I can't see the bottom of it. I don't know if
okay.
you
So, yeah,
tell
I
me.
can read it out. So, Jonah here, a very refreshing conversation to listen to. So, thank you for sharing your stories and perspectives. Yeah, it's cut out at the bottom. What sort of
Yeah, so
things
maybe you can tell us what's at the bottom, and I'm happy to answer. What sorts of things have you done or said
to those people? Let me see if I can pull it up on Facebook. It should be, I should be able
So
to see the comment.
I will share a couple of things around that. One
Yeah.
is making mindfulness super accessible. And this is something that I believe super strongly in. So I'm not a strict meditator. I'm a little embarrassed to say that. But for me, the mindfulness is very much living a mindful life. And so I would often share that or teach that, or like at, if you do huddles, which we did a lot of where I was, you bring your singing bowl and you can ding it, or you can have different simple approaches, a moment of mindfulness, or someone reads a quote, or to really just begin to start to instill that. I was super lucky in that I was able to.
Oh, I think we lost Jessie. We'll see if she gets back. So, Janar, your question here, question for both of you is, what sorts of things have you or do you say to those physicians who don't believe in wellness and mindfulness? So, you know what? This is my response. Not everything can be for everybody, right? I mean, we're all different people. We have different value sets. We come from different backgrounds. So, this isn't like trying to force somebody to believe in something they don't believe. I think we all have to come to certain things in our life just based upon whatever our life experiences are. The one thing I would say though is that if this is something that resonates with you, you know, to pay more attention to your own wellness or to be more mindful or just even kind of look into it without all these labels, then you should just do it. And what ends up happening, I think, is because it kind of happened in my case, is people start picking up on the fact that, like Jessie said, you know, what's changed? Like, you seem different. What's happened to you? And so then they become curious, and then they start asking you questions, kind of like how it happens with, you know, when you go plant-based. Like, it happened to me. They were like, wow, you're losing weight and your skin looks amazing and you look younger every day. What are you doing? And you know, and you just go, well, it's, you know, it's internal. I'm happier and I eat better and whatever. So it's not like trying to force them to believe in the same things that you believe, but you just kind of share your experience as an offering, and then hope that they are able to see the path. That's pretty much all you can do. You know, you plant a seed, and then hopefully they'll come along, or they may not, and that's fine too, because that's their individual choice. So I'm sorry, I don't know what happened. I think Jessie might have had some sort of a technical issue with her computer. So we'll see if we can maybe try to bring her back again a little bit later, maybe. But I have several other speakers lined up, and so I'll be making those announcements. So again, thank you very much for everybody who was able to attend live here and ask all these wonderful questions and make it super interactive. I think we are at the cusp of a new phase in medicine, and I, for one, am super excited about it. So, all right, you guys, everybody, this recording will be available here on both the Facebook groups as well as in the YouTube channel, and I'll post links. Okay, take care and have a wonderful Sunday. Bye, all.